Hi everybody, welcome to my channel. I'm Stacy. I'm glad to have you here. If you're new here, if you're coming back, welcome back. Let's talk about CNAs in hospice. I don't think I've talked about that too much. I've talked about being a CNA. I've talked about CNAs in facilities, and I think my CNAs are the most important asset of my team, besides my other nurses, of course, and besides, nurses. We're all important, but let's talk about CNAs. If you like what I talk about, if you want to hear more, I'd ask that you like, subscribe, and follow. Let's move on. Let's talk about CNAs. What do they do in hospice? We know in facilities that they're rounding on 10 to 12 patients, sometimes more, every couple of hours. They're feeding, dressing, bathing, and providing, incontinent care and those sorts of things. A home setting is a little different, but much the same for a CNA. So our CNAs are in the car driving just like us nurses out in the field, and they often have a higher patient load than nurses, to be honest with you. Sometimes they're seeing 7 to 10 patients in a day. So they are still having like a caseload like a nurse, and they are sometimes seeing 7 to 10 patients a day. That's really challenging sometimes, depending on geography, obviously. So they work closely with us as the nurses, and really, I can't say enough about the communication of the CNA. Again, CNAs are seeing the patient more often than we are as the nurse. Typically, when we're at end of life, the nurse is probably there every day, but in a hospice stable situation where a patient is not actively dying and their symptoms are well palliated, managed, the CNA is often there 2 to 3 times a week, sometimes even 5 times a week, depending on the patient's needs. So the families really do develop a good rapport with our CNAs, and they often feel more comfortable reaching out to the CNA to tell the CNA about something that they often maybe don't even tell the nurse. And the CNAs are good to bring those things to our attention as nurses. And we do a lot of joint visits with our CNAs when necessary. I have had CNAs that I worked very closely with in hospice, and I've had CNAs that were very good about communication. And then I've had the rare CNA that doesn't communicate with me effectively, but that's very rare. So what they do, very similar to long-term care or a hospital, if there's CNAs in hospital. I think there are some CNAs in hospitals. They're doing bathing, grooming, personal care. They make the beds. The difference in this is that they're genuinely there, once a day. They're not providing that care all day long like they are in a facility. But again, they do have to drive to each patient and provide that care throughout the day. Oftentimes, they're coming to a patient's home and getting them up out of the bed for the first time in the day. If the family needs assistance with feeding and it's in the care plan, they can help with feeding the patient. But generally, they're providing bathing, providing emotional support. They're spending time with the patients. They're repositioning to prevent bed sores, keeping the patient comfortable. I said feeding assistance. They help with transfers, walking. Depending on what's in the care plan, the CNA can do many different activities in the home. They can even do light house cleaning, and some of our CNAs have done a load of dishes or mopped the floor or, thrown a load of laundry in. I think our CNAs go above and beyond in hospice. I can't say enough good about what CNAs do. They carry around supplies in their car. They provide extra supplies in between supply deliveries. In some companies, the CNAs are solely responsible for delivering personal care supplies, where the nurses would be responsible for providing like wound care supplies and things like that. In the company that I currently work for, we deliver supplies to the home via mail. So the CNAs would supplement those supplies and bring sometimes those initial supplies. CNAs are doing some teaching with families as well. They're helping the family learn how to turn and reposition. They're helping the family learn how to change a brief. Some families have never provided incontinent care or bathed their loved one. This is the first time that they are providing care, and a lot of times they're older. They're in their 50s, 60s. Some of our patients have their spouses providing their care. So a lot of times that CNA is giving the most care that they're getting in that day. And, younger family members are shouldering a big responsibility. And so it's really important for the CNA to sometimes do these things jointly with the family, and they do. And sometimes the CNA is doing joint visits with the nurse because the family isn't able to provide that support to the CNA. So sometimes you'll see a nurse and a CNA buddied up together. Sometimes you'll see two CNAs buddied up together on your heavier patients. We still have two assists in hospice too. Not everybody is a one assist with their cares. Not everybody is able to help you turn and reposition. Again, not all families are familiar with that or able to help you with those tasks. CNAs work hand in hand with the caregivers that are there in the home, and I have seen my CNAs really partner well with the families. And again, families come to depend on those CNAs and respect them and trust them and call on them. A lot of times my CNA will know something before I do as a nurse, and my CNA is the person reporting it to me. And all the family members have my phone number. They have the company's phone number, but they are going to reach out to that CNA and give them that information because of the rapport and the trust that they've built with them based upon the cares that they give. I will tell you, I have CNAs who come out of their pocket with their own little smell good things. They know the patient likes a certain perfume, and they will provide that for the patient out of their own pocket sometimes. Are we supposed to do that? No. But my CNAs are amazing. I have seen them go above and beyond many, many times, and if I could give them all an award, I would, because they all deserve many, many thanks, many, many praises, and much appreciation. I know that being a CNA is hard on your body, it's hard on your emotions, it's hard on you in general. And as a CNA, you are developing a rapport with your patients. And so when that patient dies and you cut off that connection that you've been building for months, sometimes years, it is really emotional for the CNA too. Because they are losing someone that they become close to. They have developed a relationship with that family and a relationship with that patient, often very close as far as like giving those cares. The patient looks forward to seeing the CNA, looks forward to having them come, and they get their favorites. I think most of my hospice patients have been pretty flexible with allowing other CNAs in to give them their cares, but I will tell you, they all have their favorites, and they want their favorites, their preferred CNA. And I will just say, like nursing, not everybody's personality jives together, so sometimes you get a CNA that jives well with a patient better than another CNA, and again, that develops that relationship and that rapport that's needed in home care. Oftentimes our patients really don't have anyone to come and do these things, and they really rely on the agency to provide these services to them, and really appreciate these services. Our CNAs will sometimes even show up to help a family member get them into the wheelchair so that they could take a patient out to an appointment if necessary. How does our CNA work with a nurse? That's probably something I skipped over. Maybe I covered it already, but they're the ones, again, that are first point of contact with the patient a lot of times. So they're seeing the changes in the skin that I'm not seeing because I might be only there once or twice a week, where the CNA is again there 2, 3, 5 times a week to see the patient. So they're going to see those changes in skin and be able to report it to the nurse when it comes to letting the nurse know so that we can develop a plan of care quickly. They are also the first people that see when the patient is beginning to decline oftentimes. So-and-so's not eating as much. So-and-so's not able to help me turn and grab the railing anymore. So-and-so is not able to take a cup to their lips anymore and take a drink of water. The CNAs are often the first people that are seeing these changes in the patient. They know when they're not able to transfer out of the bed and into the chair. They know when they become bedbound. It is something that they oftentimes see first. They provide us with the information that helps us to adjust the care plan accordingly. And so if you have a good rapport with your CNA and good communication, because you are close team members, you're going to be on top of that care plan, keeping it updated in real time, right? And that's what the CNA does. They help you keep your care plan up to date and accurate. Again, they help support the patients emotionally and socially sometimes. Some patients are so lonely and they just look forward to that 30 minutes to an hour. I'm going to tell you what, CNAs are usually there for at least an hour. At least an hour. They powder these people up, fluff up their pillows, comb their hair, get them looking good. Our CNAs are spending a lot of time developing an emotional connection with our patients. Again, the family member will oftentimes come to the CNA first. So the CNA is instrumental in reporting to the nurse. Sometimes the CNA will say, hey, Stacy, did you know that so-and-so's family had this concern about this situation? I didn't know because they didn't call me. They called you because they trust you. It's not that the families don't trust the nurses as much. It's just like I said, the CNA is there more frequently. They're really giving a lot of interaction. You know, as nurses, we're there 20 to 30 minutes to an hour and seeing the patient, filling their medications, checking their vitals, looking at their symptoms. We're not there with our hands on the patient as much as the CNA. That's not to say we don't as nurses, but genuinely the CNAs are providing more of that hands-on care. Together, the CNA and the nurse ensure the patient's dignity, quality of life, and their comfort. So your CNA can tell you, you know, so-and-so gave their mom this dose of morphine and it never changed the symptoms during my visit. And that can alert a nurse to a need for a PRN visit. Maybe a nurse needs to go and adjust the medication. Our CNAs are really good at telling us, you know, a patient had a fall. Sometimes families don't call you and tell you that their mom fell on the floor and has a skin tear the size of Texas on their arm. You know, so our CNAs are very reliable reporters. They're good at calling us and telling us, you know what? Grandma had a fall and she ripped her arm open. Not that dramatic, but you know, sometimes elderly folks have thin skin and they'll tear their skin and they will just bandage it themselves and the nurse will just come in surprised. So the CNA is very instrumental in keeping us informed on what's really happening with the patient in our absence. They play a vital role in end of life. The partnership with the nurse ensures both the medical and personal need. Again, the nurse and the CNA are working together to provide that care, comfort, support to both the patient and their families. I have so much deep respect for the care that my CNAs provide, and family members will often praise my CNAs to me when I'm in there doing my assessments. You know, they will say, so-and-so is really amazing with mom, and we just love seeing her here. She brightens mom's day. Mom eats better after she sees her. You know, they really are appreciative of the work that our CNAs do, and I am appreciative of the work that our CNAs do. If you're a CNA, tell me about some of your experiences in home health, hospice, in a facility. Tell me about your interaction with the family. Tell me what brings you joy about your job. Do you feel appreciated as a CNA? I would love to hear about that in the comments. Are you feeling appreciated? Are you feeling respected? Are you feeling important in your role? Because you are, and I hope you know it. Nurses, how would you live without your CNAs? What are some CNA qualities and traits that don't get appreciated enough? Let's talk about it. Let's talk about it in the comments. I am so happy that you were here, that you watched my video, so I thank you for watching. If you like what you see here and you want to learn more about nursing, CNA stuff, and you know, my nursing journey, then I would ask that you like, subscribe, and follow. And I hope to see you soon. Bye-bye.